Let's look at our third cardio test, and the easiest one, and probably the most important one, which is resting heart rate. So it's the number of heartbeats per minute while a person's at rest. It's really, really important. A lower heart rate typically reflects a better cardiovascular system, and is used as baseline measurement for cardiovascular health over time. So should be part of the assessment for any new client because there is no fitness requirement for having this. Now, with a client who has heart health concerns or hypertension or anything like that, this is a really useful metric, okay? Very, very important to have, and will also indicate poor overall fitness. Now, if you do it after training, so after a training program, it will tell you how effective the program is for improving someone's aerobic conditioning, and is really good for screening new clients, as the high resting heart rate could indicate stress, poor cardiovascular function, and other factors. So the client wants to have a good night's sleep, not be stressed, probably a little bit hard to get that all the time, and not be caffeinated at the time of testing or immediately caffeinated, as this will influence heart rate. So the client is in a relaxed state and has been seated for at least 5 minutes to ensure they're not feeling rushed or physically active. So you can measure it on the wrist or the neck, the carotid pulse. The client remains still. You count the number of beats for 30 seconds, multiply by 2 to get per minute. If the client's pulse is irregular or the first count is different from the second, so you do the test twice, just redo it again to get a more accurate average reading. So normal resting heart rate is between 60 and 100 BPM. Now, ideally, we probably recommend trained clients to be below 60 BPM. It's a really good marker to go for. Now, a bradycardia is when they have a resting heart rate of well below 60 BPM, but you also may see it in an athlete that is incredibly fit. So some elite cyclists be looking at like heart rate in the 40s. So not very common, but can happen. Heart rate over 100 consistently could be, which is tachycardia, could indicate stress, overtraining, poor fitness, or health issues. Should definitely be checked out by a doctor if seen over time. And any kind of exercise of a cardiovascular nature and weights will improve heart rate. So 60 to 70 seems to be ideal. I do prefer under 60 for most populations. I think it's a better test. And a consistent heart rate is kind of like what we're looking for when we're testing over time. Common faults would be incorrect placement of the fingers or using the thumb, because the thumb has its pulse, and movement or talking to the test can artificially raise the heart rate. So they need to be sitting there kind of bored, to be perfectly honest. And caffeine, stress, and recent physical activity can elevate it. So try and be fully relaxed. Ideally, the morning is the best time before any form of exercise or caffeine. So low resting heart rate, sign of well-conditioned heart. Continue doing what they're doing. It's working. High resting heart rate, you want to look at improving aerobic exercise fitness, stress management, better sleep hygiene will help. Now, a couple of other tests are heart rate variability, where you will need equipment to do that, and looking at their stress and recovery and overall training load. Do not perform the test if someone's having a panic attack or anxiety, because that will increase their heart rate, or if someone's under acute illness or fever and they shouldn't be in the gym anyway at that point.